We found the prevalence of obstructive sleep apnea based on STOP score at or more than 2 is 40% in neurological population, while the recent publish of the prevalence of sleep apnea show 10% in adulthood and increased to 17% in elderly. It is similar to the prevalence of insomnia. We found 25% of neurological population has moderate to severe insomnia based on insomnia severity index at or more than 15, while only 10 to 15% of adult Americans has moderate to severe insomnia. Basically, we did not measure the accuracy of the scales. However, in general practice, we often use STOP questionnaire for screening sleep apnea. The study showed the STOP questionnaire is predict the moderate to severe and severe sleep apnea in a general population. For insomnia, we have a lot of questionnaire recognized to the use for screening, but the accuracy of each questionnaire is depend on population. Actually, this is a cross-sectional study. We cannot answer what the impact of high STOP score or insomnia severity score in the neurological disease outcome. However, we found the association between STOP score or insomnia severity index score or neurological disease outcome. Our result showed the neurological population who has STOP score at or more than 2 or insomnia severity score at or more than 15 were significant likely to have depression of any severity. If we look into like a specific center, for the movement center, we found the patient with higher UPDRS2 score were more likely to have moderate to severe insomnia. An increase of 1 point on UPDRS2 score increased the odds of having moderate to severe insomnia by 4.8%. The same result was found in the epilepsy center. The patient with higher seizure severity more likely to have moderate to severe insomnia. An increase of Liverpool seizure severity scale increased the odds of having moderate to severe insomnia by 1.3%. A home sleep apnea test is an abbreviated test with the advantage of lower cost and convenience for testing at home. However, since the EEG is not recorded, so the home sleep apnea test might not able to detect the certain type of respiratory event, so it would be underestimating the sleep apnea severity. A negative study of home sleep apnea test in someone with high pretest probability should prompt to the in-lab polysomnogram to confirm diagnosis of sleep apnea. The main finding of our study was the optimal cut point for prediction moderate to severe sleep apnea were higher than standard published cut point for stop bang and stop bang instrument, but similar to stop bang 2. The stop bang 2 use a formula incorporate age and BMI as a continuous variable rather than dichotomous variable used in the common stop bang instrument. The reason behind that because the prevalence of obstructive sleep apnea influenced independently by age, sex, and BMI. But in some populations, such as professional sport player, the BMI does not really represent the true fat mass in those populations. So the standard instrument might not be a good instrument for like a predict moderate to severe sleep apnea in those populations.